And let us focus on the slide that we already know what to do here. So we can see here several sentences, and we need to change the sentences into the passive voice. And we need to think whether we need to use an agent or do not need. So as you see, agent is a person who does the procedure. So, and in the passive voice sentences, we mention the agent with the help of the preposition by whom the person was performed. The process, the procedure was performed, for example. Well, and the first sentence here, let us listen to Asna.
Ma'am, the doctor insert the needle, and the needle is inserted by the doctor.
Great. So do we need to mention to speak about doctor? Is it necessary, the agent, or can we omit this?
Yes.
So it's not necessary. Yes, we can say the needle is inserted. That's it. That will be enough, because this is one of the steps of a procedure. Okay, then Shamisha, please, the second sentence.
Nurses often perform this procedure, and this procedure is often performed by nurse.
By nurses. Is the agent necessary here? Does it require?
No, this procedure was often performed this.
Yes, so we need to speak about nurses. So agent is required here. So because without nurses, the sentence doesn't make sense. Well, number 3 here is for Ramisha.
Yes, ma'am. The doctor then applies gentle pressure to the puncture site. A gentle pressure is applied to the puncture site.
Yes, so we do not need to use the doctor here. Great. Then John Farvin, please. John Farvin, are you here? No, John Farvin. Minus. Hala Malik.
Yes, ma'am.
Number 4.
The sister explains the procedure to the patient. The procedure is explained by the sister.
Does the sentence require the sister? Is it necessary?
Yes, ma'am.
Or
in here there is from who said to whom. So we should mention the nurse in order to understand that it is told by nurse to not the doctor. It is told by the nurse to the patient, so it's necessary, right?
Okay, if it is important that it should be done by the sister, by a nurse, so you're right. Okay, so the next is for who was speaking? Hala Malik, yes. Next is for Sultan, please.
Yes, ma'am.
Number 5.
The nurse cleans the skin. The skin is cleaned.
Yes, that's it. So we don't need the nurse here because we focus on the result. Okay, the next is for Sinju, please.
Yes, ma'am. Doctors without training don't perform this emergency procedure. This emergency procedure is not done by the doctors without training.
Exactly, or is not performed. It's very important that we focus on the fact that doctors without training can't do this. That is why we need to mention the agent here. Okay, the next is for Danish, please, number 7.
Ma'am, the doctor taps the vein, and the vein is taped.
The vein is tapped. Do we need to mention the doctor, or can we use without the sentence without the doctor?
Yes, ma'am.
Yes, the vein is tapped. Okay, and Ashwati, please, the last one here.
Yes, ma'am. Generally, nurses don't perform this procedure. This procedure is not performed by nurse generally.
Yes, also this sentence requires an agent, so we need to mention the nurses. Okay, good. I think we've refreshed what we know about the passive voice, and so we won't make any mistakes in the form of the such verbs. And now let us focus on one more procedure. As you see here on this diagram, this is gastroscopy. The stress is on the second syllable, gastroscopy. And so you can see the diagram describes this procedure, and you can see here the gaps on the diagram, and the task is to match the parts of the instrument with the words which are given to the right here. So number 1, what is number 1? So we have, yes?
Light and camera.
Yes, endoscope here, endoscope. Number 2.
Side channel for reducing.
Channels for reducing.
Yes, so the channels where something can be inserted. Number 3, please.
Flexible.
Yes, a flexible tube that goes inside the body. Number 4, at the end of the tube.
Grabbing instrument.
A grabbing instrument.
For to biopsy. And number 5.
Light and camera.
Yes.
Light and camera.
Yes, the light and camera at the end of the tube. Yes, so now we see the instrument which is used in gastroscopy. And now let us just look at some sentences. And you can see in these sentences, they are taken from a training session for doctors. We should, you can see some gaps, and we should complete the sentences by choosing a word from either the noun or the verb list. So the nouns should be used like before is. Yes, you can see is just almost in all the sentences, and the verbs should be used after is, because all the verbs here are used in the passive voice. So the nouns are the following: section, consent, patient, air, endoscope, mucosa. Let's make sure that we do understand mucosa. What does it mean? Who knows? Any idea?
What, ma'am?
Yes, what is, sorry? Who knows?
It's the lining of the stomach.
Inner lining.
Innermost lining, ma'am.
Innermost lining. Okay. So, yeah,
So the inner layer of
Stomach.
inside the body, yeah? Okay. Well, and the verbs blow, advance, swallow, give, obtain, sedate, anesthetize, biopsy. Biopsy is a verb to biopsy, okay? Well, what I would like you to do is just to make notes about what is missing here in each sentence. And I'll give you 5 minutes to do this, just to think about this, and you'll do it individually, and then we'll check together. Okay? So now the time starts. Yes, so start, please. Well, let's get started. So Who did we stop with? I don't remember. Who was the last person to speak? Okay, let's start with the beginning. Yes, Asna.
Ma'am,
Yes, please.
okay. Informed dash is dash, and the answer is informed consent is obtained.
Exactly. We were speaking about consent, obtaining consent, and here informed consent is just for invasive procedure, which is given by a patient after the procedure has been explained by the doctor. So the patient knows knows all the information about this procedure. Okay, the second one is for Shamisha, please.
The pharynx is anesthetized using spray.
Exactly. And pharynx, what is the synonym for pharynx? Because this is a medical term. Who knows pharynx? What is the synonym? The word which can replace the pharynx?
Pipe means food pipe.
Pipe or throat? Yes?
Throat.
Yes, okay. So the next one is for Ramisha, please.
The patient is dashed to induce drowsiness. The patient is sedated.
Sedated, right. Okay. The next is for Jan Parvin.
Yes, ma'am. The bioscopy is introduced and blow further down the esophagus and into the stomach and duodenum.
What is introduced? Will you repeat one more time, please? What is introduced? What did you use?
Endoscope.
Endoscope. And is the second gap? I missed it.
Blow further down.
And do you see it's not blown? It should be another verb used here. I mean, so
Give.
If you can imagine the
Advised, ma'am.
Yes, advanced.
Advised.
So
Further
it
down.
first into the mouth and then it is advanced further down. Okay. Well, the next one is for Hala Malik.
The air is blown into the stomach via side channel in the endoscope to allow visualization of the stomach mucosa.
Stomach mucosa, yes. Air is blown, you're right. The next is for Sultan.
Yes, this is the one. The patient is given a plastic mouth guard to bite on.
Who is given the first gap?
Patient.
Patient. Exactly. Okay. The next is for Sinju.
The patient is asked to swallow the first section of the endoscope.
Exactly. And the last one is for Danish.
The stomach mucosa is biopsied using a thin grabbing instrument which is passed down a side channel.
Yes, you're right.
Mucosa is biopsied.
And you see that here the sentences are the whole sentences are here on this slide. And the picture just illustrates the drowsiness, as you see. And you see that this is the description of the gastroscopy. Yes. So the slide gastroscopy, this process, and let us try to put the statements into the correct order. So I mean, in the chronological order, what the first step is. I think this is the same as given here on this slide, like informed consent is obtained, right? This is the first step. What is step number 2 here? So which sentence should we choose?
Pharynx is anesthetized.
Yes, it's also on this place. The pharynx is anesthetized, is in a spray. Then the next one, number 3, is what?
Patient is sedated.
Sedated.
Patient is sedated.
Okay. What is number 4? Yes. Will you repeat? I didn't get it.
The endoscopy is introduced and is advised further down the esophagus and into the stomach and duodenum.
Before the endoscope is introduced. So
The patient is given a plastic mouth guard to bite on.
plastic mouth guard, yes, to bite on. This is number 4. And after this, number 5.
The patient is asked to swallow the first
First session of
Yes.
the endoscope.
Okay, this is number 5, and number 6 is
The endoscope is introduced and is advanced from the esophagus to the stomach and duodenum.
You're right. And number 7.
Air is blown
Air is blown into the stomach via esophagus
Yes.
in the endoscope.
And the last one, number 8, is
The stomach mucosa is
mucosa by obstacle using a thin grabbing instrument, which is passed down a side channel.
Exactly, you're right. So these are this is the right succession of actions during gastroscopy. And now here we are going to listen to explanation of gastroscopy to a patient, or it can be endoscopy, not gastroscopy. So I mean that we are going to listen to Dr. Queen explaining the endoscopy to a patient, Mr. Beacon. And so we've seen 8 steps of the procedure. And the question is, which steps from 1 to 8 does the doctor mention? We should focus on these steps. You've got the sentences. You have made notes about them. Now let us listen and just try to understand which steps the doctor speaks about. So now I'm going to switch the recording on, and you'll tell if you hear or not.
Listening to. I need to explain.
Can you hear?
Yes, ma'am.
Okay, now please.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Well, does the doctor mention all the steps of the procedure?
Yes.
No.
Yes,
So which steps? What was the
Patient
first?
is given a plastic.
blowing the air,
Yes.
the plastic guard, mouth guard, plastic mouth guard to bite it, mentioned, and also to swallow the first section.
Okay, so and he uses other words, right? Not the words which are given here. So yes, he mentions the obtaining the consent, right? So what about the sedation procedure? Does he speak about this?
No.
Yeah.
Yes, but
Throat will relaxation.
Yes, he uses the word relax to help him to relax. Okay, what about the pharynx? He doesn't use the word pharynx. He uses another word. Yes. Instead of anesthetize, he uses a numb. Yes. Numb. Well then, yes. Here the doctor also speaks about introducing the endoscope, and he doesn't use the word endoscope, he uses the word tube. Yes? Okay, yes, you're right about the air into the stomach, and he also speaks about biopsy. Yes, so here are the sentences that he uses. And now
listening to.
We are going to listen for the second time, and you see there are medical terms, technical terms given here, and esophagus, anesthetize, pharynx, flexible, biopsy, sedative, examine, interrogate, visualize, and we won't hear these words in the conversation because the doctor tries to use some common words, simple words instead of these terms. And we should write the words that the doctor uses in his conversation instead of these complicated medical terms, okay? The same piece of information, and you just write the words next to the given ones.
Listening to. I need to explain the procedure to you and get you to sign the consent form.
Okay.
So we're going to do something called a gastroscopy. Do you know what that is?
No, I don't know.
Well, what we're going to do is have a look at your gullet and your stomach to see what's going on there.
Okay.
It's a routine procedure. What we're going to do first is to give you something to help you relax, and then we're going to numb your throat with a spray. Then we are going to pass a bendy tube, which is no thicker than your little finger, down through your throat into your stomach. Okay?
I see.
The tube will have a tiny camera on the end so that we can look at your stomach. And if we see anything there, what we can do is take a tiny tissue sample.
Right.
We're also going to blow some air into your stomach to help us see a bit better, so you will feel a bit full and possibly want to belch.
It sounds a bit scary.
I agree, it can be.
Well, instead of esophagus, what does the doctor, what word does the doctor use?
Gullet.
Gullet. Instead of anesthetize.
Numb.
Numb, yes. Instead of pharynx.
Throat.
Yes, flexible.
Bendy.
Bendy tube. He says bendy tube. Instead of biopsy.
Tiny tissue sample.
Yes, take a tiny tissue sample, right? Okay. Sedative.
Relax.
Helps to relax.
Something that to help to relax. Yes. Examine.
Look at.
Look at Eructate. Belch. Yes, you know, belch when the air goes out of the stomach through the mouth. Yes, this is belch. And visualize.
See.
To see.
To see. You're right.
To see.
You see, it's very important to use the words which can be easily understood by a patient, not when in the conversation to a patient. So not their technical medical terms. Yes, here they are. Yes, here they are, the words. And if we move to the next slide, so here we need to speak about the home assignment. So you here, after the class, you should start working with the exercise on passive voice. So where you should think of the sentences in the passive voice and in the active voice. So this exercise is attached to the Moodle site, to the assignment on the Moodle site. This is one of the assignments, so home assignment. And so the second assignment is writing an essay. So an essay which is called What I Know About Al-Farabi University. It's very important for me, for just the people working with your group to get some feedback about what you think of our university. That is why in the essay you should cover the following points. Of course, you should write your name, your age, your education, just city in short. Then what you know about Al-Farabi University. You don't need to do the research on the internet, just know what you do know about our university, because it's very important that the information comes from you personally. And the question, you should also write about why you want to study, why you decided to study our university, which is called KAZNU, Al-Farabi Kazakh National University. And the impression you got of the university and the teachers. So this is very important for me. And also mind like the essay should be typed in Word format, and the file should be clickable and accessible for editing. I mean, the previous papers, like homework 1, you should do like we normally do, just handwrite on the paper and then take the photo or the screenshot and attach it to the Moodle site. But this task should be done in Word format so that I can use this information somewhere else. Okay. So is everything clear about the home assignment?
Yes,
yes, and you understand that we need to do this before just the deadline is Saturday night, right? And